So, today we'll begin a simple primary care review on acute amphetamine intoxication. Amphetamines can stimulate alpha and beta adrenergic receptors and cause hyperalertness, hypertension, tachycardia, mydriasis, and diaphoresis. These symptoms are part of the sympathomimetic toxic syndrome. The most common causes of death related to amphetamine toxicity are arrhythmia, hyperthermia, and intracerebral hemorrhage. Clinical features: this includes agitated delirium, tachycardia, hypertension, hyperthermia, diaphoresis, mydriasis, anxiety, agitation, violent behavior, and seizures. Cardiovascular symptoms include chest pain, palpitations, tachycardia, and hypertension. Neurologic symptoms include agitation, combativeness, hallucinations, paranoia, confusion, myoclonus, and in rare cases, seizures. Musculoskeletal symptoms: overdose with any amphetamine can produce persistent myoclonus and tremors, which can contribute to rhabdomyolysis. Electrolyte disturbances: this includes hypokalemia, hyponatremia, hypermagnesemia, and elevated anion gap acidosis may occur following amphetamine intoxication. Laboratory testing: routine urine drug screens may implicate a particular drug class in an overdose. Fingerstick glucose to rule out hypoglycemia as the cause of any alteration in mental status. Acetaminophen and salicylate levels to rule out these common co-ingestions. Electrocardiogram, and a pregnancy test in women of childbearing age. All patients with agitated delirium should also be obtained of the following studies: basic serum electrolytes. If hyponatremia is present, a serum osmolality is recommended. Creatine kinase and urine myoglobin to evaluate for rhabdomyolysis. Serum creatinine to assess for renal injury. Serum aminotransferase concentrations to assess for hepatic injury. And coagulation studies, for example, APPT, PT, INR, and a platelet count, or a D dimer to assess for a disseminated intravascular coagulation. Management: agitation. The first line of therapy for treating psychomotor agitation consists of IV benzodiazepines. Hyperthermia: aggressive sedation with benzodiazepines and possibly neuromuscular paralysis may be required in the agitated hyperthermic patient. In addition, supplemental measures such as ice packs and evaporative cooling may be necessary to prevent the mortality associated with severe hyperthermia. Hypertension. Hypertension from amphetamine intoxication is generally well controlled with the benzodiazepines used to manage psychomotor agitation. Seizures. Benzodiazepines are the initial medication of choice for seizures as well. Thank you.